All right, today's COVID report, 396 new cases of COVID-19. That is up a little from last week, up about 65. Almost all of our hospitalization data is down. 464 Kentuckians in the hospital with COVID, 114 in the ICU, 67 on a ventilator. Our current positivity rate is 3.99%. We're glad that is under 4. It's about the same as our last report. We're now down to only 8 red counties. Think about when we had 120 red counties every day for it seemed like week after week after week. But we've passed another tough milestone today. We have 23 new deaths, bringing the total toll to date of the pandemic. Over 5,000 Kentuckians lost at 5,005. They include a 47-year-old man from Barron County today, a 74-year-old man from Bullitt, a 92-year-old woman from Callaway, 3 women from Fayette County, ages 66, 69, and 91, and a 79-year-old man from Fayette County too, a 71-year-old man from Greenup, 3 women from Jefferson, ages 70, 85, and 86, and 2 men, ages 78 and 83. From Kenton County, a 47-year-old man. From Logan County, a 72-year-old woman and an 84-year-old man. A 48-year-old man from Lyon County. A 70-year-old man from Meade County. A 64-year-old woman from Mercer. A 76-year-old woman from Montgomery. An 82-year-old woman from Pike. A 60-year-old woman from Warren, and a 63-year-old man from Warren. Some of our cases right now appear to be driven by another outbreak in our state correction system. Michael Brown's going to be here tomorrow to talk about that. We'd hope to have him today, but will be available tomorrow to give an update, facility by facility, where we're seeing the outbreaks. I think there's 2 primary ones right now, and again, what we're doing to address them. Total cases in Kentucky, we're getting very close to a total case number that's close to 10% of our population. 416,610 cases of COVID since the beginning. So this grim milestone that we've passed, and it feels like we've had so many grim milestones of losing over 5,000 Kentuckians. We want to mark by opening the Team Kentucky COVID-19 Memorial Fund so we can ensure that no Kentuckian is ever forgotten. So on March 6th, which was the 1-year anniversary of our very first case, Brittany and I hosted a memorial ceremony right here on the Capitol grounds. It was a moving ceremony, one that, again, balanced the 2 emotions we're feeling, that maybe there's even some guilt in feeling them together, and that's incredible grief, anguish even, and hope. Hope that we are close to ending these losses and getting out of this pandemic. Honoring the thousands of Kentuckians lost to this evil virus, and offering our respect in some measurement to those that are grieving, and the friends left behind, was part of that ceremony. Honoring our frontline workers who have worked so hard, had so many sleepless nights. Honoring everybody out there that has changed their lives and their behaviors to protect those around them, living their faith and their values of loving their neighbor as themselves. That day, like many other days here during the pandemic, we reflected on where we've been and where we're going. And now we are over 5,000 Kentuckians that are gone. And late January, when we crossed 3,000 Kentuckians, we began planting flags for each and every one of them on the Capitol grounds. But to extend this into the future, because this is a life-changing event where thousands, 5,000 plus of our Kentucky families will take pain and loss into the future, and we will all be processing what we've gone through for many years. But we also want to remember the compassion, the way that Kentuckians come together and came together, and the way that we finish this and get everybody vaccinated. So on March 6th, I announced the creation of the Team Kentucky COVID-19 Memorial Fund, which will help develop a permanent memorial to the victims of this war and to our heroes during this time right here in our Capitol Monument Park. This monument will stand in honor of all of the Kentuckians that we have lost and commemorate the sacrifices that every Kentuckian made during this dark and difficult period. The memorial will stand in tribute to the togetherness that allowed us to get through this trial, to the green lights where we showed compassion, to the bells we rung every day at 10 a.m., to the masks we wore, to the nurses that showed up and walked into COVID units to help those out there, to those who lost a loved one that couldn't be there, to those healthcare workers that held the hand of those members of our family that are no longer with us. We want to make sure that it is always remembered by all of us here in the Commonwealth. And a permanent memorial here at the Capitol will make sure that people see how important that remembering this is to us. So we've now launched a website where Kentuckians can make a donation to the Team Kentucky COVID Memorial Fund. They can dedicate a donation to someone they have lost or someone they want to honor. All donations are tax deductible, and donors will receive a receipt for tax purposes after donating. If there are additional funds remaining after the memorial is fully funded, they're going to be used to help Kentuckians who lost a loved one to COVID in reimbursing a portion of their funeral or burial expenses. To make a donation or obtain more information, visit the Team Kentucky COVID Memorial.ky.gov. Soon we'll announce an artist call to encourage artists to submit their ideas for something that can truly encapsulate the grief, the hope, the togetherness, the difficulty, all those things that we have felt this last year, the sleepless nights, but the coming together. You know, I think that this is a period that we will all remember, that is going to change all of our lives forever. And this is how we commemorate it. The memorial will remind future generations of the hardships the entire Commonwealth endured during this difficult time and the sacrifices we made to overcome it. Long-term care facilities, 7 new residents testing positive, 10 new staff, 3 new deaths attributable to long-term care. All right, let's turn to some other good news. That is our vaccination progress. Let's start off with Table 1. We announced the 1 millionth Kentuckian vaccinated today. In fact, we have gone further than that. As of the report that comes out each day, 1,002,356 Kentuckians have received their first shot of hope. When you think about there only being about 3.4 million Kentuckians over the age of 18 where more than one vaccine is available, this is an exciting number. Let's show Table 2. Here is what else is exciting for our state program. We have now used every first dose vaccine that's been provided to us. In fact, we're a little over that because that extra dose that you can get out of the Pfizer vials. Now, this is really good news because it means that we have used our resources efficiently and we gotten everybody vaccinated that we possibly can, and more, in fact, using that extra Pfizer. But what it does say is that this next week, we can't set a new record. So we set a record of 142,166 Kentuckians vaccinated this week with 1 day to go. Next week, we won't have that amount of supply. That's because we have now used up virtually every single extra dose that's been out there since the beginning, which means that we should be near 100% efficient as we move forward. Every Monday, we look at the demographics of our vaccination program as well, and let's walk through that. Let's start by age. As you can see here, the largest age group vaccinated, almost 33% of all vaccines have gone to Kentuckians 70 and older. In fact, 70.4% of all vaccines have gone to individuals 50 and older. On Thursday, we're going to be setting out a schedule an anticipated schedule for when we think other groups can open up, because our commitment is to beat the May 1st date when President Biden wants anybody in America over 16 to be able to get a vaccine. In other words, for all the priority groups to be open and everybody who qualifies to get that vaccine. We think on Thursday the schedule we're going to lay out will beat that. And that's good news for Kentuckians and for those Kentuckians in their 40s or their 30s, for the college students wondering when can I get that vaccine. We hope to have that schedule on Thursday. Now, it's all relying on supply, so we hope to beat any schedule we put out, but understand we may have to make some changes to it. When we go to gender, again, this is starting to change a little, but it's 59% women, 41% men. Ethnicity, 98.7% non-Hispanic, 1.3% Hispanic. And when we look at the racial data, we've altered this a little bit on the percentages, removing the other. We had discovered that some pharmacies and others were just clicking other every time. We think we have stopped that type of recording in the future, but it had certainly impacted our data. When we remove that, it shows our Black and African American population at 5.25%. If we put the other back in, it'd be 4.82%. So I want to make sure that we can compare apples to apples this week to last week. If we use the other category, we will have improved. Again, we won't have improved as much as we'd like, but each of the last 3 weeks has shown at least a couple tenths of a percentage point increase as we go. I think that's due to some great leadership inside our Black and African American communities, as well as intentional outreach and pop-up clinics that are going on. Again, whether we operate on the 5.25% or the 4.82% number, we still have a lot more work to do. It's not okay where it is right now. We continue to have so many offers for help that we continue to say yes to each and every time. We are committed to addressing this. I'm glad that we're making progress. We are not making it fast enough.